Hi everyone, Dr. Jeff back with you this week with Co-ops and Melissa. And Melissa, we're running out of time with you here.
Yeah.
Term's coming, Santa Claus coming to town pretty soon, Christmas on the weekend, pretty
Yeah.
exciting. Hopefully you've been good this year.
Yep, no cold one stocking this far, so not too bad.
So what are we going to talk about this week?
We're actually going to be talking about how poor posture can affect someone's health. So we're going to kind of start off with assessing a posture.
Great, let's go.
All right.
So a couple ways we can go about assessing postures. One is standing. So what we're going to do is we have a list of standing sideways here. So we're going to just check out, we're going to look at where her head is. What we want to see is we want to see her earlobe, her canal kind of even with her shoulder here. So if we're kind of looking here, you can kind of see her earlobe's a little bit forward. That means her head is postured a little bit forward. Next one we look at is kind of your shoulder joint down to the middle of your knee. And again, we kind of see that the shoulder and the knee don't quite line up. So again, her head is forward and she's leaning forward. So one thing I noticed with that, so now her curve of her neck is rather straightened out, and that has straightened out her thoracic spine and her lumbar spine. So instead of having that nice little C curves, now we're getting a lot straighter, and that can lead to some issues down the road. So the next way we can assess posture is just sitting. This is kind of your typical workstation type of setup. We've got a list of working on our laptop here. So one thing you notice the difference between standing and sitting is how much further now her ear is in front of her shoulder. So she's really coming forward. The other thing now is the shoulders are kind of rounded forward. So she's getting a hunched posture. That can put a lot of pressure again in here. That can lead to something called the dowager's hump here, where you start to get a little lump in here because all the pressure going through there. Another thing we look at, if you look at her legs, all right, she should be at 90 degrees. We're not quite at 90 degrees, so what's happening now is her hips are going down instead of up. And again, that's going to cause some tightness in the hip flexors. And again, we notice how flat her thoracic spine is here. So once again, head forward posture, rounded shoulders, flat spine, that's going to lead to issues down the road with her health.
So with your anterior head posture that I was showing, that can cause your back neck muscles here to be super tight, which will pull on the base of your skull and cause something what we call a tension headache, or cause headaches. That'll also cause certain neck pain. Another thing is it'll cause your front neck muscles here, which we call scalenes, to be super tight or hypertonic. And that has a lot of important nerves running through there. So if they're tight, it can compress those nerves and cause something like carpal tunnel syndrome or thoracic outlet syndrome. It can also cause tingling and numbness down your arms and cause weakness within your arms.
Yeah, and with that forward posture that we saw, either standing or sitting particularly, that can actually tighten these muscles in your groin here called your hip flexors or your psoas iliacus. They're a very important part of your pelvic floor. Your pelvic floor is a very part of your core. It's also very important to keep everything together. And what that can happen with a weak pelvic floor is that can lead to bladder problems, menstrual problems, things like that. So it's very important to keep those muscles tight. So a poor posture such as too much sitting or leaning forward, those muscles get very tight and lead to problems.
Yeah, when you're leaning forward, your center of gravity and your center of pressure is going to change. So that is going to cause you to have problems with balance and stability, especially those who are aging and a little bit older. That can change significantly and can be more of an issue.
Yeah, as we mentioned, this training of the spines, as we talked about when we were doing the assessment, the center of pressure should go through your disc at a certain point. And if you don't have the normal curves, that center of pressure can move forward in your disc and put the pressure in a position of the disc that's not supposed to be. That can cause the disc to wear out faster than it's supposed to. You have in the center here, you have the nucleus. It's a nice soft center. The center of pressure moves forward. That nucleus is going to start to get pushed back, and you can see it starts to crack here to the point where eventually you can get a disc bulge pushing onto the nerves in your spinal cord.
Yeah, so another thing with rounded shoulders, that can put pressure on your heart and your lungs, which will cause issue. And if you think about it, it'll diminish your range of motion. So if your head is leaning forward, when you try to lift your arms, it's not going to go very far. But as soon as your head gets pushed up, your range of motion is much more available.
So now that we've assessed your posture, we kind of know what we need to work on to help with that, some of those bad posture things. We're going to show you some exercises we can do to help with that, remedy that bad posture. So the first one I do is called a chin tuck. So all it is simply bring your chin back. It's not bringing it up, it's bringing it straight back. And you should be feeling that pulling kind of up in here. One thing I suggest to my patients is to do it is whenever you get to a stoplight, do a chin tuck. Kind of hold it for the length of time of the stoplight and then relax.
Another one that's really good for an anterior rotated shoulder, so when you kind of have the hunchback, is a chest opener. So that you would just grab your hands together and pull back, opening your chest, and you can actually do a chin tuck while you're at it. Another really good one is cat-cow. So we've actually done a video demonstrating cat-cow. So if you want to refer to the cards, we've linked that so that you can check how to do cat-cow. Well, thanks for watching our video. We hope this encouraged you to assess your posture and to correct some of your poor posture to avoid those health complications. And feel free to comment an idea of what you want to see next. Leave a like, and as always here at Goldsworthy Wellness, we got your back.